All right, I got an error, guys, but I've seen this before, and I think we're live on Facebook. Let me just double check it. I've seen this error before, and usually it doesn't mean anything. PA Lyme. Are we live? We are now live. We're good.
It's official.
It is official. We're good.
All right, good for you. Thank you. Um, I want to welcome everybody to our September virtual Lyme Impact session. My name is Eric Huck. I'm the president and co-founder of PA Lyme. I'd like to advance my I'd like to advance my slide deck. We have with us tonight, in terms of being able to present this presentation, Bill Moore. Bill Moore is a board member and also runs the Pittsburgh Lyme Support Group. We're particularly excited of having Dr. Mulders' presentation tonight. And if you're a follower of our virtual Lyme Impact sessions, you know that we are moving and have been moving really in the direction of, it's more than just Lyme disease and it's more than just antibiotics. So, multiple reasons and causes that people don't feel well. And every individual is a little different in terms of what remedies and treatment are good for them. Before I jump right into the introduction of Dr. Mulders, I'd like to bring everybody up to speed on what we have been doing as an organization throughout the spring and the summer. So, our impact so far, you're going to notice that we have sent material to 38 libraries: Franklin, Fulton, Adams, Delaware, Cumberland, and Dauphin counties. 38 libraries where we were able to get Lyme and tick-borne disease prevention information to. We've had some generous grants. We've had some generous donations. One from Seneca Resources out in Western PA. They have allowed us, through their financing, to produce 200 hiking trail tick prevention signs. We have distributed 100 of them, and those counties, which are really kind of in the footprint of Seneca Resources, Cameron, Tioga, Lycoming, Jefferson, Butler, those are hiking trail signs that are going up in those particular counties. We have 100 trail signs still available. If you go online, you'll be able to order them. You're able to get up to 4 signs, no questions asked. You can put it at a trailhead, you can put it at a park entrance, you can put it in a particular area where the forestation, where it's a walking trail, neighborhood trail, municipal trail. If you are in need of more than 4, there's an email option there that you can ask us how to get more. But there are still 100 free that can be put up in those counties. You are probably familiar that at referral@palyme.org, we have a Lyme literate healthcare referral system in place. Last year we did 767 referrals, 2024. In July, we did 105 referrals. In August, we did 101 referrals. For those individuals that suspect they have Lyme, maybe they have recently been diagnosed, or if they finally come to the conclusion it may be a tick-borne disease, maybe Lyme, we will try to identify a Lyme literate practitioner that's in our network that has been vetted, and we try to provide 2 or 3, 4 healthcare practitioners, and this is a free service that we do here in Pennsylvania. I want to kind of shout out that the Dare to be Tick Aware and the Tick Prevention Initiative, largely that was done by Amy Teal, who is the Dare program manager, and also she's the regional leader in Delaware County. The referral program that we run has really never been run smoother than how it's been for the last year. And that's really largely the result of Jackie Confalone and the efforts that she puts into her care, her professionalism of getting that information out. You probably are aware that we held in June a medical conference at the Drexel University College of Medicine. We did this with ILADS. It was our fifth ILADS medical conference over the last decade. We had 65 medical practitioners that showed up, 2 day conference, and it went really very well. We've also had the ability to produce and print 8,000 Dare to Recognize brochures. This is a particular brochure that has been requested, and it's helping parents, teachers, and school nurses identify tick-borne infections in children. So, not only the symptoms, diagnosis, looking at testing situations, alternative treatment protocols. It is really something working with our medical professionals to produce this brochure. We have 8,000 that are printed. So if you're a school system, if you're a nurse, if you're an educator, and you would like to get your hands on bulk quantities of this particular brochure, please go online at palyme.org, find where that information is, and make that request. We'll work with you to try to get bulk quantities to you. Through another grant that has been extended to us, we're in the process of having our brochures translated into Spanish. We have taken one as a test case. It has come back. We've hired some Spanish speaking individuals to read it to make sure that it translates properly. But it is something that has been requested over the years of us, and we finally have been able, through financial funding, to be able to do it this year. So 2025, even though we're only in September, has really shaped up to be a bellwether year for us in getting our impact out there to the state of Pennsylvania. So, coming up, I would like to suggest mark your calendars. The Young Adult Lyme Social Group that meets monthly, the fourth Thursday of every month, from 7 to 9. The one coming up in September will be next week, next Thursday, September 25th. And we're going to round out the virtual Lyme Impact series. In October is going to be Dr. Sam Shore out of the Washington, D.C. area, former president of ILADS, treatment protocols, bionutraceuticals, looking at an herbal approach to the 3 Bs, Bartonella, Babesia, and Borrelia Lyme disease. We also have Daniel Cameron, Dr. Cameron, in November 18th with pediatric Lyme and tick-borne diseases, looking at the symptomology, the signs, diagnosis, testing, and treatment protocol and the follow-up. If you are on Facebook and you surfing around Lyme Facebook groups, undoubtedly you've stumbled across Dr. Cameron's Facebook, and he's been very active in social media in his virtual presence with pediatric Lyme. So, just for housekeeping, if you want to ask any questions, the way that we do this, if you're familiar and if you're not familiar, you can ask questions by posting it in the Q&A section in Zoom. If you're reaching us on Facebook tonight, you can ask your question in the comments section. We hold all of the questions until the end of the presentation. Bill Moore will gather the questions, and then he will kind of prioritize and organize and ask Dr. Mulders the questions, and he will hand deliver it. Typically, what happens is individuals will text me questions as well, so I will interface with Bill to get the questions to Dr. Moore. So, with that, I would like to introduce Dr. Moore. More, forgive me. I'm giving you some medical credentials you haven't earned, Bill. So, Dr. Mulders, forgive me for saying that. So, Dr. Mulders is an MD. He is a specialist in internal medicine. He was trained in the Netherlands and did his residency in internal medicine at Presbyterian Hospital in Philadelphia. He has practiced integrative and nutritional medicine since 1993, so almost 20, a little over 20 years. He uses, actually, a little over 30 years, he uses a holistic approach in utilizing diets, vitamins, nutrition, herbs, prescription medications, and lifestyle modification, and all in the quest of getting better. His focus is on chronic diseases, certainly including Lyme and tick-borne diseases. He advocates that chronic health problems, they are rarely caused by one thing, but they're the result of multiple factors and causes which certainly vary with each individual. Dr. Mulder's expertise is helping individuals feel better by boosting their immune systems and by removing obstacles that stand in their way from a health and a medical perspective. His practice is located in Wayne, Pennsylvania, near King of Prussia, outside of Philly. He also has hours in Mountaintop, Pennsylvania on Fridays. So, with that, I would like to really give a generous welcome, Dr. Mulders, to you. Want to thank you very much for taking the time this evening. His presentation will be on our website, and his slide deck is available for those that may have an interest. So, with that, Dr. Mulders, allow me to turn it over to you.
Good. Thank you, Eric. Let me just get the share the screen. Let me, there we go. One sec. I have to just, I clicked out of that and now to get back in it. Huh? There we go. Is it? Let me see. Can you see it now, Bill?
We can't see it yet.
Not yet. Let me see what happened here. I'm sorry about that. And that. There we go. Now you
It's
can.
coming up now, yeah.
There we go. Okay. And you can hear me well?
Sounds good, yes.
Well, thank you for having me. So what I want to do tonight is I want to kind of give a quick overview of how I look at Lyme and chronic disease in general. And then I want to later on focus on hormones, the brain, and energy. So I'm going to just get started, yeah? So first, what I'm going to say is just for information. I'm not intending to diagnose or treat anybody. So I practice integrative medicine. So what does that mean? I'll bring various forms of medicine together, both conventional medicine and then also various alternative modalities. The way conventional medicine looks at chronic disease, in my opinion, is not solving the problem of chronic Lyme disease, and many of you might have had that experience. And the principle comes that regular medicine looks at things in what I call a linear way versus a systems approach, what is more when you look at things from a holistic point of view. So a linear approach often looks at illnesses in a very narrow way. The diagnosis and treatment is very narrow defined. Often it's very organ oriented. And then the treatment seems to be more simple. Like, you got the Lyme bug, so then you get an antibiotic and then you get better. Most of these treatments are based on protocols. You have a standard way how you diagnose and you treat Lyme, for example. While a systems approach has more, you look more at things from a very broad way, and it goes out from several principles, Yeah, the first is that illness is complex, and the causes of chronic illness are multiple. It's multifactorial. And then also the way you approach it is individual. One person gets sick from something one way, and another person gets sick another way. And so Lyme disease, the easy way is, you get a tick bite, you get a rash, you get some joint aches, you go to the doctor, you get a couple of weeks of antibiotics, and then you're better. And if you're not better, you might get some more antibiotics. And if then you're still not better, then it can't be Lyme. Yeah. I like this cartoon. I've used it many times before. We run a lot of that. Doctors often don't believe in chronic Lyme. And so many people, they get kind of this answer. This is kind of a cartoon from when I was growing up, a Dutch cartoon, and this bear is kind of a gentleman bear, and he used to say, "What I don't understand doesn't exist," and so we're going to try to go beyond this. Yeah. So this is kind of a little diagram of many people, by the time they walk into my office and before they get diagnosed with Lyme, they have seen many, many different doctors, a rheumatologist, infectious disease, orthopedist, neurologist, and, you can later on look at the slides and go to all these different practitioners, and many of you may have that experience. Also, many of you have had many, many, many tests. Yeah, and I'm not going to go into this. You have blood testing, neurological testing, scans, biopsies, cognitive testing, all kind of various things that you might have had. And many times, nothing wrong is found on that. And so it's a very frustrating journey. So why is Lyme so difficult? Yeah, one is symptoms can be confusing. There are often many different ones. The testing is often not reliable. The Lyme bug often doesn't travel alone. There are other bugs that come along for the ride. And then also 3 weeks of doxy often doesn't cure it. But the last one that I want to focus on right now is more that it all depends on your immune system. And it's more when you look at it practical. There's some people, they get 3 weeks of antibiotics and they're better, and then maybe you're not. Yeah. So these are just the whole list of symptoms that you can later review. There's some of them very obvious, others are weird. There's a lot of weird symptoms people can have with tick-borne disease, and then there's more even than this. Yeah. The testing is difficult. When you use the standard sequence of testing, where they first do the ELISA test and then the Western blot. Well, if those are both positive, you have almost 100% chance you have it. But when they're not positive, that doesn't necessarily mean you don't have it. And that's a big problem. So often Lyme gets missed. So labs may vary very greatly in their results. Yeah. Testing can be very helpful, but often it's not conclusive. In the end, the clinical diagnosis plays a role. I've seen over the years some people that had all testing was negative, even with the labs I use, but the story was compelling. We ruled other things out. And then we said, well, let's just treat it and see what happens. And then you start treating people and they start getting better, and then suddenly the test turns positive. These are just a list of possible other bacteria that can be carried by ticks. And so many people with Lyme, they have various other bacteria like Babesia, Bartonella, Ehrlichia, etc. And that makes it all way more complex. Yeah. So why do 3 weeks of doxin often not kill the bug? Well, the Lyme bug is a very smart bug. Doxy, which is the standard drug, often at the dose they use is an inhibitory drug and not a killing dose. And when for many people you inhibit the bug and the immune system takes care of it, but there are also people where it's just not sufficient. The Lyme bug can suppress your own immune system, so it kind of puts shackles on you, so it's hard to fight back. it can shift from all kind of forms from one end to the other where it's harder to treat, and it can hide out everywhere in the body. And then there's the issue of biofilm, which I will not talk about today. Yeah. So can you overcome acute Lyme disease with antibiotics only? Well, most of the time, yes, but often not. Yeah. Can you overcome chronic Lyme disease with antibiotics or antimicrobials only? In my opinion, no, but you sure need them. Yeah. So it all depends on your immune system. So what do we mean by that? Yeah. So this is just a diagram of all the various things that can play a role with respect to chronic Lyme disease, and in fact with all other chronic diseases. And I'm going to go quickly to all these here, the ones all the way clockwise, and then the one that is at 9 and at 10 and 11 o'clock. That's what I'm going to talk about a little more. Yeah. So a lot of history, large potentials of the diagnosis with history alone. We have to listen and make sure that we get the right diagnosis. Yeah. So here are the Lyme and the co-infections, and there's lots of different antibiotics that are used by Lyme doctors, antiparasitic medication. There are a whole number of herbal protocols. I saw here that later on sessions will be talked about. So then what is also important is that what you eat. Many people that come into my office and they're diagnosed with Lyme disease and they've tried antibiotics, but they're just not eating well. Sugar suppressed immune system, eating processed and junk foods is a problem, and I always recommend people to cut out all sugars, to eat from scratch, and to choose organic foods if they can. There's various diets that are often promoted, paleo diets, Lyme diets, anti-inflammatory diets. I personally eat more a low-fat, plant-based diet. It really varies from person to person. Yeah. So then there's food sensitivities. I find almost all people that come in with chronic illness, when I do a blood test for food sensitivities, they can be, having trouble with sometimes 10, 15, 20 foods. And so I do the test, and when the food show up, we cut them out. We'll see how they do, and then we add them back in, see which are the bad foods that are, pushing the immune system down, besides Lyme disease. Because that's what I find often when people have these infections, that other things stress the immune system in such a way that the body just can't get on top. Toxins and chemicals. People have been exposed to all kind of metals and chemicals, and there are various chelators and herbals and sauna that can help with this. There are particular tests that can help you establish if that's a significant issue. Then there is mold. Mold came kind of into view about probably 5 to 10 years ago. It's like, why are people with Lyme not getting better? There were always some people were not getting better, and more and more mold has come into the attention. That many people, they get exposed to mold and it affects their immune system, creates inflammation in their body. And so there are various things you can do to test that. There are antibody testing, there's urine tests for mold toxin. And when you find them, of course, you have to try to clean things up in your house, and also do detox with binders. The problem with things like mold is that when you have it in your house and you need to remediate your house, it's a big deal. It can be very expensive, or you have to move. So I tend to, really want to make sure that that's an issue. And I often deal with a lot of other stuff first before I would consider mold to be an issue. Because in the end, we're all exposed to it. It's interesting. I personally did a urine test, and I had mold toxin in my urine, and I'm just not sick. And so you have to really be careful that, to figure out what is important for you. Stress is very important. First, the illness creates a lot of stress. Families are not often understanding. So there's all kind of various things you can do to help you deal with the stress. And again, you can refer to the slide to see the various options. Yeah. Sleep is a huge issue too. Many people with Lyme, they have either hypersomnia, they're sleeping all the time, they lay down, they fall asleep, and they're not rested. And then many people can't sleep. So there's a whole bunch of natural products that can help with that. Actually, the one thing that's missing in here is oxytocin that I'm going to talk about later. I found that to be actually very helpful for sleep. There's a certain sleep hygiene that you have to have, and then there's various medications that are sometimes necessary for you to be able to sleep. Physical, structural things. There are all kind of various therapies that can be helpful to help with your structure, like physical therapy, chiropractic. I remember, my wife had very long-term Lyme disease, and when the Lyme was there, she would go to the chiropractor and it would help, but then it would go out all the time. But when the Lyme got better, she was much more able to hold her adjustments. Going for a walk, doing exercise, Tai Chi, making sure you have a good mattress, things like that are very important too to help you get well. Then digestive imbalances. Yeah. 70% of your immune system takes place in your digestive tract. And many, many people have imbalances in the gut that places an enormous tax on the immune system. So there's various medications you can use. I use a lot of antifungals. Whenever I give an antibiotic, I always use an anti-yeast medicine like fluconazole, ketoconazole, nystatin, and there's a few others. There are a lot of herbal antifungals. And then, of course, you want to make sure that you don't feed the yeast by eating a lot of sugar and carbohydrates. And then we need to heal the bowel. I use some of these herbals like slippery elm, marshmallow, DGL, even when I'm treating with antibiotics. It helps people not get nauseous or stomach pains from the antibiotics. So I'm kind of proactive in that. And then there's, of course, probiotics. We need good bugs in the bowel. Yeah. So then we get more now to the point where, Eric asked me to talk about was more about hormones. And so what happens when we have chronic disease, it puts an enormous strain on our endocrine system. The endocrine system is our adrenals, our sex hormones, our thyroid, our pituitary. Hormones help us, interact with the world outside. And so the biggest one that I found that almost every chronic Lyme patient has adrenal issues. Adrenals are tired. And the way I test that is by doing a saliva cortisol test. My experience is when you check hormones like cortisol, like this here in a blood test, that's usually normal unless you have severe adrenal insufficiency. So I do it in a saliva test. We test, usually I test 4 times because there's a day-night rhythm in cortisol. I feel that saliva testing gives you a better idea about tissue levels, what's going on in the tissue. So for example, this is a sample curve of a cortisol graph, and a normal graph is in the middle of the dark green here. So this looks really very low, and this is not uncommon that I see. And so I make, when I see that, I make a diagnosis that people have what we call chronic fatigue. And it's not that the adrenals are damaged, they're just squeezed out. There's a very important concept, and it's the concept of organ reserve. Yeah. So in the body, every organ, when you're healthy, is not working to the max. Like for example, right as I'm sitting here, my heart is not working to the max. It might be beating a beat faster because I'm giving this presentation, but it's just working at a certain percentage of its capacity. Now, when I go outside and I start running up and down or run around the block to the max, then I can push my heart to the limit. So the heart has the ability to work more. And so that this counts the same for other organs, for our endocrine system, for our lungs, for our brain. And of course, some of that diminishes as we age, but it also can diminish as we get, more and more stressed by illness. So, here you see various of the steroid hormones like pregnenolone, which you can actually buy over the counter, DHEA. Here we go to cortisol, and down here we get to testosterone, and then here to estrogen. Later on, I will talk also about cortisol and testosterone with relation to energy production. Yeah. So what is the job of cortisol? Now, cortisol helps to mobilize fat that then the mitochondria can use for energy. Yeah, so it does that. It's also anti-inflammatory, and it plays a role in blood sugar. And it also helps the immune system. Even though cortisol is a steroid, we have in general the image like, steroids suppress the immune system, but cortisol at a normal level actually helps the immune system. Here's I've written it out a little bit. So, there's various symptoms that are associated with low cortisol. Well, one is that you're tired all the time. You tend to get tired more as the day goes on. Another symptom is that people have low blood sugar. Yeah, you tend to get hypoglycemic, so you need to eat in time. Otherwise, you get irritable or brain foggy or dizzy or lightheaded. Another common symptom of low adrenals is that you have trouble standing bright light in your eyes, or that you have trouble with loud noises. Also getting dizzy when you get up quick. Another interesting symptom of low adrenals is waking up in the middle of the night. Now, because it's important for cortisol to mobilize fat that then the body can use for energy. So if your cortisol is low, you during the night is the longest time you don't eat because you rely more on carbohydrates when you can't mobilize your fat, and carbohydrates don't hang around that long. And so when then during the night is the longest time you don't eat, and suddenly in the middle of the night your blood sugar drops, and your brain doesn't like that, and it sends a signal to your adrenals to try to make cortisol, but cortisol is struggling, so it also triggers the adrenals to make adrenaline. And the adrenaline wakes you up, and then you wake up in the middle of the night, and then your mind is going, you get in a kind of a low-level stress response, you're exhausted, but you feel trembly inside, and then you lay awake for 2 hours, and then you fall asleep at 4 or 5 o'clock, and you have to get up at 6. So you get into this pattern, and so when you then start working with these adrenals, then, often people sleep better and have more energy. So I work with the adrenals. When I find that, I use a certain number of botanicals that are really helpful. They're called adaptogenic herbs like rhodiola, ginseng, ashwagandha, and I use some glandular products, but I also use very small amounts of hydrocortisone, because it turns out that hydrocortisone is chemically virtually identical to cortisol. So by giving that in small amounts to the day, it can really help not only with the energy and the sleep at night, but also in helping your body get over these infections. Yeah. So the other thing that is important is sometimes it's testosterone, and I'll talk about that a little later. So to support this whole steroid endocrine system is really important. The other thing that I find often is that people have I call it subclinical hypothyroidism. You know, there are labs that TSH that your doctor does looks fine, but when you look at the actual thyroid hormone T3 and T4, especially the free versions of that, they're often in the very low normal range. And so when you then support the body a little bit, it can really make a huge difference in your energy. You know, the interesting thing about regular blood testing is, you know, when the doctor does a test and it's within normal range, well, that range is a range. And I always say it's whether you have an A or a D, it's all pass. But I tell my patients always, you know, when you might feel a lot better at a B level than a D level. So when you start working with these hormones, you sometimes have to just give a little bit and see how you do. And you know, bringing them all in balance. Yeah. So then there is the hormone oxytocin. I have to say that until about a year ago, oxytocin was really not on my radar. So oxytocin, it's also known as the love hormone. You know, many times when I mention that to patients, they've never heard of it. But when I say, have you ever heard women getting a Pitocin drip to induce labor? And they say, oh, yeah, I know that. So that is oxytocin. So oxytocin is a peptide. Yeah? It's made in the brain and then secreted to your pituitary. But they find that oxytocin is way more. It's found in many places in the body, in your heart, your retina, your pineal gland, the adrenals, the ovaries, testicles. Yeah? So it's found in many places. You know, the nice thing about oxytocin is that when you give it, it actually increases your own production. You know, many other hormones, when I give somebody a lot of testosterone, I give them a lot of hydrocortisone or a lot of thyroid, usually the body then suppresses its own production when you give too much. And the nice thing about oxytocin is it doesn't do that. It also is considered to be a neurotransmitter. It goes to almost all areas of the brain, you know, and it controls social memory and fear. You know, in general, when people take that, they feel just way more relaxed, yeah? And it can be helped with chronic pain, like fibromyalgia-like pain, muscle pain, migraines. It can help with sleep. It helps with anxiety, depression, and also it seems to reduce inflammation and autoimmune illness. You know, you can actually, if you go online and you punch in migraines and oxytocin, or insomnia and oxytocin, or fibromyalgia and oxytocin, or MS and oxytocin, you know, cognitive decline and oxytocin, you're going to find almost all of them that there's an indication that oxytocin might actually be helpful. So since I've been doing that, I've been using this a lot in my practice. Yeah, it's not easy to measure, to just get a blood test with LabCorp or Quest. But I determined the deficiency and the suboptimal level on a symptom questionnaire that was developed by a Belgian endocrinologist, Thierry Hertoghe. He's a very prominent endocrinologist in the integrative world. Let me see if I can pull that up here. Wait, I have to kind of go back here. Let me see if I can pull that up. One sec here. I may not be able to pull that up, that questionnaire. Let me see here. Well, I can't pull it up. So that I can do that on my computer, but it's not working right now. So I'm sorry about that, but I'll get it to Eric. And so it's a questionnaire that just asks questions about symptoms, and then you add the score up. And if your score is low or in a deficient range, then you can try to take it. So my experience so far with this, I have to say that I'm quite excited. I'm more than amazed about how many people feel better. I've written probably over 200 prescriptions for this in the last 6 or 7 months. So I've seen a lot of improvement in sleep and less anxiety. Yeah, people have less pain. They feel overall more happy or good. You know, I've had one person, I said, well, how are you doing with the oxytocin? And, you know, and the lady, she was kind of, and she said, well, I just feel good. And I say, well, how do you feel good? And she was quiet for a moment, and she said, well, I don't know. I just feel good. So, and that's really nice to hear from your patients. Yeah. I haven't really seen any problems with it. I think the few problems that I've seen, that there are some people who can get away with way lower doses than I initially start them on. And so that's really a matter of adjusting the dose. You know, you can stop at any time. There's no danger in it. And I find that it's better balanced with other hormones. Yeah. You know, I see the whole hormonal system more like an orchestra. I'd say the thyroid is more of a modified amino acid with iodine added in. The cortisol and the sex hormone are steroids. And this oxytocin is a peptide. And, you know, and somehow they all work together. But how that exactly happens, we don't really know. Well, the interesting thing is that most people, they want refills when they run out. Yeah. So it's really a great addition, and it's helped a lot of my Lyme patients. Good. So it's available commercially only in injection from regular pharmacies, but it can be made in tablets, lozenges, nasal sprays by compounding pharmacies. They've done some studies with nasal sprays in kids with autism. Kids with autism have very low oxytocin. And I've had one autistic kid who made a great difference. He is more excited about doing things. I saw them yesterday, and the mother really reported that made a big difference. So the next thing I want to talk about is your limbic system and your brain. Yeah. So what is your limbic system? The limbic system is I call it your lizard brain. It regulates everything: your emotions, your circulation, your digestion, your hormonal system. Everything that happens automatically basically happens in your limbic system. And my experience is that people that have had chronic illness have a lot of dysfunction in the limbic system. Yeah, and I want to just kind of try to explain how that comes about. So we know that when the body feels threatened or attacked, yeah, by either a physical injury, an infection, toxic exposure, an emotional trauma, you know, our brain goes into what we call a fight, flight, freeze response. And it's supposed to do that because it protects us. But when the danger goes away, the brain should go back to a relaxed, what we call parasympathetic state, where the body recovers. Now, what we know now is that when the body gets threatened or attacked, and the attacks are very, very intense or long-lasting or multiple at the same time, that even when the danger goes away, that the brain keeps being trapped in a hypervigilant, overreactive state. And you know, people get sensitive to everything. And I actually believe that when people have had chronic Lyme, that even the brain is hypervigilant to even the slightest increase of these bugs in the body. Because the question is, do you ever get rid of these bugs? You know, and some people might and others don't. But somehow still people get better. You know, the interesting thing is that we all have bacteria and organisms in our body that could kill us, but they don't. You know, somehow they're kept in their place, or they're in the right amount, and they don't cause a problem. You know, but on the other hand, our brain is aware of all of this. You know, your brain knows the temperature in your big toe. but mostly it ignores all these signals and that information. Because we would go nuts if we knew all the things that the brain constantly notices in the body. So the brain's job is to determine what's important and what not to bring to our attention. Now, when we've been ever threatened, by either a serious illness like Lyme disease that affected us greatly, or an injury or an emotional trauma, suddenly the brain now develops a hyper alertness about the injury. And because I've had a lot of people that I treated for Lyme disease, and we did a lot of things that I mentioned here even before in the slides, and then they're doing pretty good, and then some not so bad stress happens, and suddenly all the Lyme symptoms come back. And I almost think that what happens is that your immune system gets a little suppressed by the new stress, and then these bugs pop up a little bit, not really in a serious way, but just a teeny bit. And suddenly the brain notices that and freaks out. It overreacts to that. And you say, well, how is that possible that the brain would make my joints get inflamed? A couple of years ago, I was reading in a science magazine, which is the premier science magazine in the country. There was an article that mentioned that they found cells in the mouse brainstem that regulate inflammation by sending signals to the vagus nerve. And the vagus nerve is the main nerve that is part of what we call the parasympathetic system, which regulates a lot in the body. And when I saw that, I could suddenly I could understand why there's so many strange and weird symptoms with Lyme disease, like where joint pains move around. It's really hard to imagine that the bugs move around, but that in the end, the brain starts dysfunctioning that way. And it's almost like the brain develops a PTSD about these bugs. And the same thing you see with chemical sensitivity or mold sensitivity. When, people, they walk into a room and they say, oops, somebody has perfume, I have to leave. The few molecules of perfume that are circling around, they're not really harmful, but the brain thinks they're harmful, and then it starts reacting, and it's the brain's reaction that causes the problem. And so in one way, a lot of the chronicity, the brain plays a role. Now, that doesn't necessarily mean that it's all in your head, because many people probably that are listening, they've been told that it's probably just psychological. Well, that's not what I'm talking about. So what can you do about that, So I want to go back to that image of the brain overreacting. And the way I have a visual of that, it's almost like whenever the brain gets stressed, that it gets trapped in a vice. And the areas of the brain where the brain could respond adequately in saying, oh yeah, there's a few bugs, or there is a few chemicals, but it's not really life-threatening and can ignore it. It's all, these rooms are locked up, so to speak. And so now you get these constant stress responses that manifest in insomnia, anxiety, PTSD, and sometimes you develop OCD symptoms. So now we have these inadequate responses constantly. People feel anxious all the time. They're not sleeping. And so what do we do in conventional medicine? We try to tone them down, but, and how do we tone them down? By, we try, antidepressant, anxiety medicine, we use herbs, we pray, we meditate, we have cognitive behavioral therapies. They try to tone these stress responses down, which is great if it works. But the problem is that in the end, the stress response is wrong to begin with. It shouldn't be there. The brain should not be reacting as if there is a danger when there is no real danger. Yeah. So in the last 5-6 years, I tried to work with all these techniques, and I still do. But in the last 5 years, I came across a treatment called IASIS microcurrent neurofeedback, and it's a very simple treatment. We hook electrodes on the scalp, and then a small current. There's three areas. It takes about a minute each, and sometimes a little longer or shorter. You don't feel it, and it's almost like when we do that almost like that vice can relax, and suddenly the brain has access again to its original programming where it can react to stress adequately. So what we've seen with this treatment is that people sleep better, their anxiety gets better, they can better deal with the stresses in their life. And I have had a number of my patients that I had to retreat for Lyme every so often because the symptoms would come back, and then we've done that, and now suddenly they don't relapse. I'm really excited about this treatment. I've been doing it. There are now a number of practitioners in the area that use it because I've been encouraging them to get this equipment. I actually am of the opinion every school should have that. So the nurse in the high schools can treat people for anxiety with this. But it's also been really helpful in the treatment of chronic Lyme disease and some of the psychological symptoms that are related to that. So then finally, I want to talk a little bit about mitochondria. So mitochondria are the power stations in the cell. Every cell has them. For example, every healthy muscle cell has about 2,000 mitochondria. Every healthy brain cell has 5,000. And many chronic illnesses, including Lyme disease and long COVID, diabetes, fibromyalgia, chronic fatigue, they're all mitochondrial disorders. Now, the causes might be different, but in the end, when the mitochondria make energy, you are getting better. No cellular energy, no healing. Yeah. So I will put a scary slide up, the next one, but I'm going to try to explain it to you. Yeah. So this here is a diagram of a mitochondria. Yeah. And again, they make the energy, and the energy is this ATP here on the right lower side. That's the energy molecule. Well, how do the mitochondria make that? Well, to make that, you need to mobilize fat. And for that, you need cortisol that we just talked about earlier. And you need thyroid and epinephrine. And, all these things are involved in mobilizing fat. Yeah, then carnitine helps the fatty acid gets in the mitochondria. Down here, the oxygen comes in, this O2 oxygen, and then these fatty acids, they get broken down and they go to this real complex biochemical mechanism called the Krebs cycle or the citric acid cycle. Those of you who had biology in high school, you probably had to learn some of this and you probably forgot all about it. And this whole complex mechanism needs a lot of different nutrients, especially many B vitamins, but others too, to work well, but also anabolic hormones, and that is testosterone. We talked earlier about testosterone. And I give testosterone to both men and women, of course, in appropriate doses. It plays a huge role in estrogen, in the energy production. Yeah, so this here, what I'm just describing, is called making energy with oxygen. Yeah. Now, the way we utilize oxygen does go down with aging. Yeah. And so I'm here 66. And so, I hope I'm feeling more here, but, I do less good than a 30-year-old. But many people that have these chronic illnesses, they might be 40 or, you're 25 and you feel like you're at a range of 80. So what happens normally with aging, but also with chronic illness, that when we're healthy, we have no trouble mobilizing fat to use for energy. But then we start relying more and more on sugar and carbohydrates, and and the problem is that they don't last very long. And then slowly we start even relying more and more on what we call anaerobic metabolism, which is making energy without oxygen. And then sooner or later we get mitochondrial decay, disease, aging, degeneration. But many people that I find have chronic tick-borne disease, they're stuck in these two middle things here. Yeah. And so what does this anaerobic mean? Yeah, when we go back to this diagram, so when we rely more on sugar and carbohydrates, yeah, the problem, yes, a lot of it goes down here, but a lot of it goes down here where you make energy without oxygen, which is called anaerobic, which is very inefficient, and it builds up debt. Yeah. You in the form of lactic acid, and many of you might have, they feel heavy in their muscles, and you overdo it a little bit, and then you're achy. It's because you build up lactate. Yeah? So what I see is like when you are healthy, it's almost like you have, like, using financial analogy that often helps when I explain it to patients this way. If you're healthy, you have enough money in your checking account, yeah, to pay all your bills. Yeah. So now your car suddenly breaks down and you have a $3,000 repair bill. Well, it's a bummer, but it turned out you had money in your savings account. Yeah. Now, a person who has weak adrenals and can't make enough energy, they don't have enough money in their checking account. So what they learn to live with less, so, and you see that often, that the people that come to me with any chronic illness, including Lyme disease, that they often just do less and they adapt their life to having less energy. So they're managing that way, but now the car breaks down. Well, it turned out that the savings account is empty, yeah, and so they have to run to the bank, and the bank gives them a loan, but the bank wants their money back an hour or two later with 100% interest. And that is what often happens to people who have chronic illness, including Lyme disease. Whenever a little extra stress happens or they overexert themselves a little bit, then it's payback time with more exhaustion and achiness and heaviness and brain fog. You might all very well know that when the more tired you are, your brain doesn't work. And then everybody gets afraid that they have Alzheimer's, but most of the time it's just that they can't make energy. Yeah. So this is a very important slide. I use that always with my patients, and it actually very simply explains that. Yeah. So there is that, and the mitochondria. Yeah. And often you can support that by supporting the adrenals. There are nutrients available, very vitamins that have maybe 20 different nutrients that support the citric acid cycle, and then together with hormones, and then also there are various oxygen treatments, which we're not talking about today, that can help improve your energy. So that was kind of towards the end of my talk. We talked about hormones, we talked about the brain and the energy, and and of course the other things can play a role too. So what is really important, that when you are ill or you're not getting better, that you figure out with your doctor which of these things are important. You don't need to deal with everything, but you have to figure out which are the most important. Good. So, it's a very complex and multifactorial illness. Yeah, it affects your life. You're not alone. There's a lot of people working, constantly learning more to try to figure out how we can deal with these chronic illnesses. So what I don't understand, what Ollie B. Baumel said, does exist. And we keep working and learning more and more. And even though I've been doing what I'm doing for 33 years, I find I keep learning and learning. Lately I have more of an eye for genetic issues. You all might have heard of the MTHFR, but that's just part of genetics. And, you know, some people, you have to go really into the depths with that. Yeah. So that's it. So thank you much for listening to me. That was my grandson many years ago. He's now 10 years of age, and that was my daughter's dog, and they were having a look out of the window. So thank you very much. Yeah. I'm going to stop the share now. Good. Okay.
Thank you, Dr. Mulders. Very informative. I've received a couple of texts, people asking if your slide deck will be available. And for those that may have missed it, not only will this recorded presentation be on our website, but also the slide deck will be available. So, and Bill, can you tell if we've gotten many questions?
We don't have any questions yet, but if anybody has questions, please use the Q&A feature. If you're in Zoom with us, please use the Q&A feature to ask your questions, or if you're on Facebook, please leave a comment on this live video, and I'll be on the lookout for those.
Dr. Mulders, the one question that I received was asking about the microcurrent protocol. Who would be a good candidate for that, and what do you believe the outcome would be, the potential?
Yes. So, you know, in one way, you could do microcurrent on everybody. You know, there are people who are, you know, executives, and it helps them reduce the stress. It has shown benefit with ADHD, with PTSD, anxiety, insomnia. In general, what I see is that once you do it, that as you do enough treatments, that the results tend to be lasting. It's not like when it helps that you have to keep doing it forever. You know, there's some practitioners work with autistic children, you know, with their behavior. There is actually a pilot study that was done at UC San Diego, where they took people with traumatic brain injury years later, and they did functional MRI scanning, where they show great abnormalities. People still had symptoms, and by doing 10 or 15 of these sessions, they found that their scans improved, but also their symptoms improved. So you know, the way I always say even the brain has, just like anything in the body, wants to fix itself. Yeah, and when we're not getting better, something is standing in the way, or the body is lacking something. You know, many times we look at toxins, chemicals, bacteria, lack of nutrients. But as I was working with chronic Lyme, I found that the brain, the programming of the brain plays a real important role in that. You know, that sometimes you get the body well, but the brain is stuck in a pattern that throws the body constantly back. And I think that microcurrent treatment is a huge, really a very useful tool in helping people with that part of it.
Thank you.
All right, we're starting to get some questions to roll in. The first question: once you have tested positive for babesiosis, should you get retested to see if it's still in the body? And the same question for Lyme.
You know, my experience is that retesting, first, the problem is that, you know, labs are all different. And so in my practice, I usually treat until people are better. I think people can have these bacteria in their body and just don't get sick. We always look at that. I have to kind of tell a personal story about that. When, you know, my wife had Lyme for about 7 years before we figured out that's what she had. We were living in California and moved to Pennsylvania, and my wife wasn't well. And, you know, when finally, when I started practicing in Pennsylvania, people on average weren't getting as well as in California. And so I thought, what's here that's not there? Because in the 90s, there was some talk, well, there's no Lyme in California. It was kind of interesting. And so when Lyme came to my attention, I started testing and found it left and right. And one day my wife says, well, maybe I have that, you know. So we tested her and we found the DNA of the Lyme bacteria in her blood. And so, you know, and I was kind of not really that comfortable using a lot of antibiotics for Lyme. So we went to this Lyme doctor and, you know, suddenly he looks at me and he said, well, you have it too. I said, what do you mean I have it too? It's like, you know, he said, you have Lyme. So I did a Lyme Western blot and all these bands showed up. And then I gave myself a penicillin shot in each buttock and collected urine 3 days in a row. And Lyme antigen showed up in all 3 of them. But I never was sick and I've never been sick. You know, I took antibiotics for a couple of weeks for the heck of it. So it's very interesting. So when I deal with patients and they have, you know, a positive Lyme test and I start treating them and they get better, yeah, I treat them until they're better. But you might do a Western blot test and it may still show positive. That's the difficulty with that. It's really not, there is no test that can tell you you're cured, in my opinion.
Okay, thank you for that. Next question. Hello, can you ever really get rid of Lyme?
You see, that is a difficult question. Well, I say you can be better. And I don't mean be better, some better. You can be, you know, when you use the word cure, that's really a very dangerous word to use, also medically legal. But, you know, people just go back and they have their life. You know, I have many, many patients that I treated and they're just living their life. And you know, they have other things other people have too. So I do think that Lyme is not an obstacle to being healthy again.
All right, thank you. Next question. This person says, I once read long ago that one of the doctors in Connecticut who treated thousands of cases of Lyme starting in the late 70s said that while Lyme is a bacteria, it behaves like a virus. Do you agree with this?
Well, it's a bacteria, you know, it's a spirochete. I'm not sure what the difference would be between virus or bacteria that way. I mean, both virus and bacteria can make you sick, you know, and the biochemistry and how it works is, you know, many people that have Lyme, they often have had exposure to underlying viruses like Epstein-Barr, cytomegalovirus, parvo, and some people, they do better too when they go on an antiviral. You know, I've had some patients where I do that. You know, with various results. So I'm not sure that I can answer that question in a satisfactory yes or no way. Yeah.
Okay, we have a question. I hope I can relay it properly because I don't recognize the abbreviation, but it says, can you explain what can be done if you get severe, and it looks like an L/S head pain, or options for that? And if the person who asked that could, maybe you know what that means, Dr. Mulder.
You mean lumbosacral pain, you mean?
Or perhaps that's what they mean, yeah.
Well,
But
I
I
mean,
can't, yeah.
so you have low back pain. That's what that is. Well, you
I
know,
see.
that could be related to Lyme, but it could be related to many other things, you know. Sometimes you might find benefit with chiropractic. I've seen a lot of chronic low back pain related to the digestive tract, you know, because sometimes when you look at the back, we always look at the back, but right on the other side is where your digestive tract is. So
Well, I apologize. This person is clarifying that they meant left side head pain is what they meant.
left-sided hip pain.
Head pain.
Or head pain. Yeah, well, you know, in one way, you know, I've seen a lot of various symptoms get better when you treat tick-borne illness, but also do many of the other things that I mentioned earlier. You know, it's never just about treating the bug. You know, actually, Eric started that by saying that, you know, it's never just about let's kill the bug, the body gets better. But, you know, people can have all kind of odd sometimes, non-explained headaches and neurological symptoms with various tick-borne illnesses.
All right, if there are any more questions, we still have time for more questions if there's anybody out there. Eric, I don't know if any have come to you directly.
Well, I don't know how much this is a question, but this is a friend of mine, also a Lyme patient, and he and I both have had Lyme for about 15 years, and I state that when the full moon comes, and he as well, when the full moon happens, we can tell we're not feeling as well. That a day before or a day after, there's a 24, 48-hour window that during the full moon, it's flaring the bacteria in the body. And he's kind of jokingly asking, are we the aberration, or have you experienced that in the past, Dr. Mulders?
Well, I mean, I'm not necessarily keep track of the lunar cycles other than what see outside, but the longer I do this medicine, it's really amazing how many things are influencing us. You might have heard, let's say some people have chemical sensitivity, and while they smell a few molecules that other people don't smell and they get sick. There are now people who have what they call electromagnetic field sensitivity. I mean, they can be in a room where there's Wi-Fi. I mean, I've had, so what we find is when the body is sick or longer, we become sensitive to all kind of things. Of course, in the literature throughout, the last few thousand years, there's no doubt that people are apparently affected by the moon. When you say it's a full moon, in ERs, they often have the feeling that they get more people and more drama in the ER when it's a full moon. So something is affecting us. And so that could very well be, and I'm not sure there's a treatment for it. What I always find that in chronic illness, that what it happens is that, a healthy body has resilience. Yeah, you can deal with stresses. And with chronic illness and aging, you find that our resilience decreases. That so more and more things that before we might not even notice or that wouldn't bother us suddenly start bothering us. And it's the idea that, the bucket of the immune system, when you're chronic ill, it's running over. Here it's the head, and there it's the joints, and there it's the gut and the mood, and the bucket is full. So as we age, our bucket shrinks. Illness makes our bucket shrink. And some working with the hormonal issues is trying to make your bucket bigger. Treating Lyme and cleaning your diet up is trying to scoop something out of the bucket. So it's a principles, and we're learning more and more about the bucket by looking at genetics. Or it's like, well, what does the gut have to do with Lyme disease? Well, it does. And how it exactly works, we don't all know, but we also can't ignore it depending on where the patient is at. Yeah.
Okay, we got some more questions. I'm sorry, go ahead.
Run away for the moon, It's just there.
That's true.
Yeah.
We have a question about biofilm busters. Do you have a biofilm buster that you recommend?
I have to say that I worked with biofilm busters for a while, and then I was kind of unimpressed. But, I work with ozone. I think ozone helps decrease biofilm. I know stevia does. There's some enzymes that I use. I have an enzyme formula that I sometimes use. It's actually interesting, not necessarily a part of my basic things that I do. The reason why is that I just was unimpressed, the difference it made. And there's also a limit on what you can give people. When you start working with the hormones and the gut and the Lyme and, on a certain moment, people take so much stuff it's just practically not possible. People don't want to do it. I can't convince them to do it. So I kind of make my judgment calls, like there is like the biofilm bustles is something that's more on the back burner. When people ask about it, I don't mind adding something in. It's the same with LDN, like low dose naltrexone. I've been working with that for 30 some years. And, my general thing is, But, when people ask about it, I give it because it's not harmless. It doesn't harm people. And there are people who report that it helps them. So, they're just within my practice, certain things that I find play more of a role than others, but that doesn't mean that they're not valuable. Yeah.
All right, next question. Any recommendations on how to improve your immune system to better fight Lyme?
Well, I mean, in one way, that's what we just talked about, clean your diet, reduce stress, support your mitochondria, support your endocrine system, move and exercise, make sure you get good sleep. All those things are actually, in fact, why that are necessary often to get on top of Lyme. It's rarely just taking a certain supplement, I have to say. There's a lot of, I boost my immune system. And yes, you do. All your immune cells have mitochondria. Sugar suppresses your white blood cells to kill bacteria. It's really important. You can't get better when you drink sodas and orange juice and eat donuts. It's just impossible. Yeah.
Someone has a question about nerve damage to the knee. Is there something they can do for severe nerve damage of knees?
Well, that probably depends on what the cause of it is. Nerve, it depends how severe it is. When you still have pain, that means the nerve is still alive. When you're all numb and you don't feel anything, well, the nerve probably is dead. I mean, there's certain modalities, lipoic acid can help with nerve regeneration or nerve pain. I think there's certain forms of laser therapy, low intensity laser therapy that can help with nerve regeneration. It depends a little bit of whether the nerve damage. The other thing is actually to determine whether it's actually is nerve damage. I've seen lots and lots of people have numbness, tingling, nerve pains, and then they get nerve conduction studies and they're all normal. And I think it's more that the nerve is dysfunctional. Yeah. Energy production. Nerve cells have the highest number of mitochondria in the body of all cells. So whatever. It's not a short answer.
All right, next question. Does Lyme relate to, this is a question I'd like to hear your answer actually. Does Lyme relate to seasonal affective disorder? Winter gets harder for me each year. And the person is also asking about Raynaud's.
Yeah. Well, I'm sure our whole neurotransmitter system, and it's all in the limbic system. Seasonal affective disorder, we get that you feel more depressed in the winter, possibly because there's less light. Now, when you have that and then you get Lyme on top of that, it's an additional stress. It could very well make that worse. And on the other hand, when you have already, when your nervous system is not working appropriately, that also might make Lyme symptoms worse. So it's a principal question. How it exactly works, we don't know. But there are probably a whole bunch of things you could do about it that could make the symptoms less or make them better. Raynaud's is a symptom that you see with some autoimmune disorders. Yeah, it's almost like the nerves, the blood vessels are hyperreactive. They overreact to cold or other stimuli. And, there's some things that could help with that, natural. I find ginkgo is helpful. Sometimes there are now various nutritional products that are based on red beets that help increase nitric oxide, which is a vasodilator. Of course, you want to also work on the underlying illness that makes that hyperreactivity happen. There's some other, drug-wise, they sometimes use verapamil, which is a blood pressure medication, and that they use verapamil. So that, it's always, again, it depends on the rest of the body, and then there may be some things that can relieve the symptoms.
All right, thank you. Next question. Could the lack of a thyroid and ovaries make it more difficult to heal from Lyme and co-infections?
Well, it could. I mean, it could. I mean, it depends a little bit on what your symptoms are for that. I mean, if you have, no functioning thyroid and you're given, levothyroxine, or Synthroid kind of a medicine, the body has to convert that into T3, and some people have trouble with that. So sometimes, maybe changing your thyroid medication from levothyroxine to something like Armour or NP thyroid can be helpful. And the same thing is, well, when you don't have ovaries, well, I don't think that's so much of a problem, because when women go into menopause, the ovaries become non-functional. And when you have healthy adrenals, then the adrenals can make some estrogen. Women with healthy adrenals, it's my experience, they do way better with menopause. So you can always work with bioidentical hormones depending on what levels are low. So yeah, I think there are things one can do about it. Anything that stresses the body makes it harder to get over Lyme.
All right, here's another question. If on a kill protocol, should you use a binder to remove or detox your body?
I didn't hear the first. If you're on what?
A kill protocol, antibiotics or an herbal protocol to kill off Lyme.
Well, I use binders often related to mold. And, you can detox and help the liver along. Encourage people to do sauna and move and do lymphatic drainage techniques that they can do. I refer them to some YouTubes where they can do it themselves. I don't necessarily use binders when I'm treating Lyme disease, but that, so, I want to kind of comment on that, just what that question brings about. There's so many different practitioners that use so many different methods to treat chronic tick-borne illness. In one way, when you would line up, say, the last 12 speakers that have been here, like I'm here now, and I would say that nobody does exactly the same, because it's a real complex problem, chronic illness, including chronic Lyme disease, and it depends on the experience of the practitioner and what modalities they're familiar with. My experience over the years is that when I hear about an herb or a certain product, it sometimes takes me 5-6 months working with patients before I get a sense of what it really does. And sometimes I get a sense that I say, I'm not sure. And other things I find more important, but that's all within my experience working with my patients. And, there are, like I personally, for example, I've seen a lot of people that have tried just working with herbal protocols, and then they end up with me. But I always say the people who get better with herbal protocols, I don't see them. So I'm biased that way. So, when people get better, they're better. They're not coming to me because some herbalist or a natural healer got them better with herbs. And, to get as a practitioner to become familiar and practical with herbs to work with your patients. I use some herbs for tick-borne illness. I use the products that developed by Byron White. And the reason why I use them, because they're easy to do. Some of the herbal protocols are very complex, and I've had trouble getting people to do that. But that doesn't mean they don't work. That is very important. When you work with patients, I have to always figure out in the beginning, what are people willing and able to do? Can I enroll them in what I think is necessary to get them well? And it's not always successful to enroll them in something. Does that make sense? Yeah, good.
All right, we have a question from Facebook. It's kind of a difficult question, in my opinion. How do you find out if you still have Lyme bacteria after treatment, or if you just have some sort of disorder, immune system disorder after being treated?
Yeah. Well, depending on what the symptoms are, you can sometimes, I do retest, and this, because sometimes retesting is helpful to motivate the patient to do more treatment. Because it's sometimes hard, when the patient says, well, how do I know I still have that? And the symptoms have recurred, or they're not all better. And none of it is a black and white answer, an yes or no, but retesting can be helpful. And of course, the other question is, well, what disorder would it be? What name do you give it? Yeah, I always find when doctors don't know what something is, they put the word syndrome behind it. Yeah, fibromyalgia syndrome. That means you're hurting and we don't know why. Now there's something that does play a role in I think in chronic illness. It's called CIRS. That's chronic inflammatory. Chronic inflammatory response syndrome. So something in the body keeps creating inflammation, and it keeps them sick. And Lyme can be one of the things playing a role in that, but mold and other things can play a role. And now we're finding out more and more that many people with the real chronic illness, that they have certain genetic tendencies that prevents them from getting better. But some of that genetic information can help us. That's the whole idea of the MTHFR mutations, that sometimes you use certain particular nutrients and suddenly the immune system can work better.
Well, that was the end of the questions, and we're right at 8:30. So I think if there's no more questions, I think we can wrap it up, Eric.
I think we can. The one comment I'd like to add on the individual that asked the question, how do I boost my immune system? I think the answer that Dr. Mulders gave was accurate. I would encourage that individual to focus on the nutritional aspect. You get a Lyme bite, you get tick, you end up getting some kind of a co-infection. So you have an infection, which turns into inflammation in the body. And it's the inflammation in the body that really triggers the immune system to always be on. So your immune system thinks it's fighting a saber-toothed tiger always, because the inflammation is overriding the system. So, of all the things in detoxing and boosting the immune system, I think nutrition probably is the keyest ingredient. What I'd encourage that individual to look at is an anti-inflammation diet. So eat a diet that reduces inflammation. A gluten-free diet. Gluten causes inflammation. Sugar causes inflammation. Processed foods causes inflammation. Alcohol causes inflammation. There is a book by McFadden, if I'm saying the name correctly, called The Lyme Diet. And it really is an anti-inflammation diet. My experience working with dozens, hundreds of Lyme patients is the individuals that really focus on cleaning up their diets tend to feel much better sooner. So for what that's worth, I would say really focus on a low inflammation diet and see how that works. I wish you luck. So Dr. Mulders, always, I love your style. I love the conversational nature of how you present information. The fact that you took the time out tonight to do this and you're making your slide deck and information available to the individuals at PA Lyme, I mean, that's really very meaningful. So with that, thank you again. Bill, thank you for doing your end. Let's call it an evening and we'll see everybody again in October. So with that, good night, everybody.
Thank
Good night.
you.
Thank you, Dr. Mulders.
Bye-bye.